Coronavirus is evolving faster than scientists can adapt vaccines. That is according to the European Medicines Agency. The warning comes amid an autumn surge, with WHO saying that it has seen a tripling of COVID cases since September in Europe, at a time when flu is also on the rise. So joining me now is Dr. Richard Peabody, head of the high threat pathogen team at WHO Europe. Richard, great to have you with us. Thank you for taking the time. Now, I have to say that a lot of us thankfully managed to avoid seasonal flu during lockdowns over the past couple of years. So what challenges does seasonal flu combined with COVID present?
Thanks very much. It's a really important question. Clearly, we're coming now out of the autumn into the soon into the winter period, and as you mentioned, as we forecast, we have been seeing a surge in cases of SARS-CoV-2. Fortunately, this hasn't led to the huge impact on the healthcare system that we could potentially have seen, and that reflects the previous circulation and impact of the vaccine programs that countries have rolled out. But what we've also seen is that as countries have relaxed their various COVID interventions, we've started to see a resurgence of influenza. And flu has started to appear now in a number of countries across the region. Now, of course, there are things that we can do about this, and vaccination remains really one of our most effective tools against both flu and COVID-19.
I just want to ask about that warning from the European Medicines Agency saying that they can't keep up with variants, making new vaccines for each one. So are we seeing an increase in variants, and what could that mean?
No, this is something which we're working with countries and monitoring very closely, and we have seen obviously a range of different variants emerging over the period of the pandemic. But the important thing to remember is the vaccines still remain very valuable. They still provide good protection against severe disease. And so the vaccines available this winter, really important to get those, that they will provide good protection against hospitalization and against death. And of course, there are other things that we can all do as well to reduce our risk of being infected and of infecting others. Just these simple measures, such as catching our coughs and sneezes, making sure that we don't mix with others when we're unwell with a respiratory illness, and also thinking around potentially wearing masks and so on when we're going into crowded places, or when we're particularly in contact with vulnerable others, such as in settings like hospitals and care homes.